In this next section of the training, I will be talking about interventions during referral. For this section, you'll also need a copy of the EBD evaluation planning form and the OSEP memo dated 11/07. This graphic depicts the special education process beginning with interventions. In Kentucky, research-based interventions are required to be provided for any struggling learner. Research-based interventions must be implemented prior to or as part of the referral process for a student suspected of having a disability. In most cases, the intervention process is completed prior to a special education referral to ensure the student has been provided with appropriate learning experiences to meet his or her unique needs. In some cases, it is appropriate and possibly preferable to complete interventions during the evaluation process. An example of this might be in the case of students who require intensive outside supports, including hospitalization, that may impact the school's ability to provide interventions in the general education classroom. Another example might be when a parent initiates a referral. If the ARC accepts the referral, interventions will be completed during the evaluation process. The ARC may not delay the evaluation because RTI has not been previously conducted. Kentucky regulations for providing interventions contain several provisions. Districts must have a process in place that ensures appropriate research-based instruction is provided in general education settings by qualified personnel. Parents must be provided with data-based documentation of repeated assessments of achievement or behavior that have been collected at reasonable intervals, reflecting formal assessment of student progress during instruction. If the student has not made adequate progress during the intervention period, a referral for an evaluation shall be considered. The most common intervention approach used by schools is a three-tiered system that can address academics, behavior, or both. Interventions are always implemented in the general education setting by general education staff. Universal interventions are most commonly referred to as Tier 1 interventions and are implemented with all students in the general education classroom. Secondary interventions, typically called Tier 2 interventions, are usually implemented with students who have made minimal or no progress with core Tier 1 instruction. Tier 2 interventions are usually provided to small groups of students, and those students continue to receive Tier 1 instruction as well. Tier 2 interventions are provided in the classroom or provided outside of the classroom. Tier 3 interventions, also called tertiary interventions, is provided when students do not demonstrate sufficient progress with Tier 2 instruction. The intensity and frequency of interventions increase at the Tier 3 level and are typically provided to an individual student or in groups of 3 students or less. Pause the training to complete the 2 tasks on the slide. Space is provided on your guided notes to answer the first question. Create a list of the top 5 interventions used in your school or district to support students with behavior challenges. The second task is to access the website that was developed by Kentucky Special Education Cooperative's Behavior Consultant Task Group and their partners. The website focuses on research-based interventions. You can go to this resource and review which resources are recommended. If a student fails to make adequate progress, despite increasing intensity of interventions, a school may suspect the student is a student with a disability. If so, a referral is completed, which documents interventions that have been implemented, who provided the interventions, and the data and results of the interventions. Other information is also included on the referral, such as results of hearing and vision screenings, information regarding achievement data, and notes of teacher concerns. At the referral meeting, the ARC should review the referral information, noting the areas of concern. The ARC should also summarize and analyze the impact of interventions completed prior to the referral. Based on this discussion, the ARC should determine if a disability is suspected, which warrants an evaluation to determine eligibility for special education. At this time, the ARC should also have some conversation about the potential exclusionary factors of lack of instruction in reading and math and limited English proficiency. This will allow the ARC to either, number one, develop an appropriate evaluation plan to gather necessary information, or number two, allow the ARC to determine what additional interventions might need to be implemented prior to considering a referral. If the ARC determines an evaluation is warranted, the ARC should plan the evaluation based on the student's unique needs and discuss how interventions will continue during the evaluation process. Parental consent for evaluation should also be obtained, and the 60-day timeline for evaluation should be calculated and shared with the ARC. These questions may be used to guide the ARC's discussion regarding the areas of concern exhibited by the student and to assist with determining if there is a suspected disability. Has a decrease in behavior frequency, duration, or intensity occurred as a result of interventions? If yes, consider the sustainability of the intervention in the general education setting. How does the student interact with peers in age-appropriate manners in social situations? Is the student able to accept redirection and feedback from others without significant outbursts or meltdowns? Does the student demonstrate anxiety, hyperarousal, or explosive, reactive behaviors? Does the student understand how to regulate his or her own emotions during difficult tasks or situations? These are some additional questions to guide the ARC's discussion. Does the student demonstrate significant withdrawn behaviors or social anxiety across settings? Does the student demonstrate significant fears about school that impact attendance or academic performance? Does the student have a history of hospitalizations for mental health concerns? Has the student experienced adverse childhood experiences, ACEs? And if so, is there evidence that the ACEs are the primary reason the student exhibits behavior problems? The ARC should consider the unique needs and circumstances of English learners who are suspected of having an emotional behavior disability. Tragic events and trauma can disrupt learning and cause an English learner to manifest inappropriate behavior at school. It is critical to explore both school and non-school environments. Although a student may need assistance managing and controlling his behavior, a referral to be evaluated for special education services may not always be appropriate, specifically if problems stem from cultural shock, a tragic event, or chronic stressors in the student's home or school environment. The school should implement effective research-based interventions designed to address a student's unique behavior and cultural needs. Interventions are intended to be proactive and may include implementation of a behavior intervention plan in the general education setting to better determine whether it is a suspected disability or other factors related to the student being an English learner. The results of the RTI process need to be documented in the conference summary notes of the initial referral meeting. Interventions and what skills were targeted need to be described. A summary and analysis of the impact of the interventions must be evident in the conference summary notes. A list of interventions is not adequate. The ARC must include a description of each intervention and the impact of the intervention on the student's behavior.